Hey everybody, thanks so much for joining me here today again on our second Cabral HouseCall of the weekend. Yesterday we had so many amazing questions on the show. Hopefully you got to tune in. We talked about perimenopause-based symptoms. We talked about nerve pain and sciatica. We spoke about receding gums and how to recover quickly from that type of surgery. We spoke about a birth control-based device. And then we also spoke about how to test for healthy levels of your heart, things like cholesterol, CRP, and homocysteine. That was episode 3473. You're welcome to check out that show after listening to today's, which if you want to read along with today's questions, will be at stephencabral.com/3474. Let's dive in. Let's see what the community is asking. Just opened up the big document the team puts together for me and does such a great job. And it looks like the first question's from Christy. So before we get to Christy's question, let's give you the standard disclaimer that the FDA and FTC want me to read. They want everybody to read this because, again, as not being a patient or private wellness client, I have to share with you, I can't provide you with any medical advice, medical treatments, medical cures, and medical diagnosis. But of course, what we're going to do is we're going to get you to figure out what the underlying root cause is to what ails you and to rebalance the body so that you can be fully healthy and happy again. That's what it's all about. All right, Christy's up first. Christy says, "Hi, Dr. Ball. Thanks for all you do in your amazing, well-researched supplement line. What do you think about oral supplementation of high molecular weight hyaluronic acid for joint support as we age and things like osteoarthritis? Do you think there are better things to take, or if we are doing the basic things you recommend is worth adding into the mix or a waste of money? Thank you." Okay, so happy to answer this. What I would say is it's always foundational first. There's no point in adding things like hyaluronic acid, even collagen, if you're not taking the building blocks for the body. So that's why we use the daily nutritional support or daily activated multi, omega-3s, vitamin D3. Like those, that's really your top three. Then you might add on the daily probiotic support. You might add on the daily fruit vegetable blend. Yeah, like again, you'll start to add like the really heavy hitters, full spectrum magnesium, etc. But it's really those three. But then you say, okay, should I add on something like hyaluronic acid? Sure, great research behind it, but also glucosamine, chondroitin, and MSM if we want to for the overall joints. But do you need to start taking those right now? No, I don't think so. Unless we start to see there's degeneration, we don't need to start over supplementing right now. Is there going to be any real harm to those? No, probably not, right? I would use advanced collagen support starting now if you wanted to, and I would use probably a little bit extra full spectrum vitamin C or whatever vitamin C that you like, and maybe balanced zinc. So that's more building blocks for the tissues of the body. And then make sure you get enough protein, that you're doing weight training. Weight-bearing exercise actually doesn't wear out the joints, it strengthens the joints. Only poor movements and overuse can add to those types of injuries and wearing down. So that's how I would look at it. But no, I don't think that they're bad or a waste of money. I just don't necessarily know that they're necessary, especially if people are not doing the foundational based work first. All right? All right, Allie's up next, and Allie says, "Hello. I have a son that was born with multiple heart defects. AV canal, mitral valve prolapse, 3 open heart surgeries at the age of 1 to fix the issues. Hands of amazing surgeons and the grace of God. He's now 16 years old and hasn't needed another surgery in the past 15 years. That's amazing, Ellie. So happy to hear that for you. So happy. But because of his health history, it has been recommended that anytime he's done dental work, even just a routine cleaning, that he take an antibiotic an hour beforehand. I cringe every time I have to give it because I know of the ill effects. I heard you say you don't want to take antibiotics unless it's life-saving. Would you consider this one of those times? Do you think it's overly conservative to take an antibiotic for prevention?" All right. I've answered the same question with dental and antibiotics probably 5 or 6 times. Now, I'm going to answer it again because this is what I want to do. Like I'm happy to do that. But the reason why I say that is that you wrote in about 6-7 weeks ago, and you could have got this answer 6 or 7 weeks earlier. And if your son was having surgery within that time, you would have had that answer. So that's the only reason why I'm saying that, right? I'm happy to answer the questions. Also, you can ask and get same-day answers from my amazing team at cabralsupportgroup.com. 34,000 other amazing humans there. We don't advertise. It's literally an organic group that's grassroots. You ask questions, lend other people support. We give you answers. So we'll find you the podcast as well. All right. Here's the thing though. Of course, I can't give you medical advice, but when people have heart conditions, even arrhythmias, the general recommendation is take an antibiotic, because if there was ever bacteria or cut or anything like that, moved in the bloodstream, went to the heart, that would be really bad, right? So Could this be considered life-saving? It could be, right? Like it could literally be considered life-saving. You're going to take a little bit of antibiotic during dental surgery just to make sure that the bacteria or anything there doesn't go to the heart. Okay, it's justifiable. And I'm not against that. And if you were to do it, here's what you do. You just take clean gut probiotic, 1 upon waking, 1 before bed, or just 2 upon waking, 2 before bed. 2 capsules a day at 16 years old, totally fine. And then you would take 1 scoop of healthy gut support. Again, I can't give medical advice. Healthy gut support in his shake every day or just in water whenever he wants. And that will really counter effect any of the antibiotics effect on the gut. So just if you want to do that, that might be the compromise. Some people choose to take something like GI Balance, 3 times a day at each meal, which has thyme, clove, and oregano, also powerful antibacterials, antimicrobials. But I'm not saying that you should do that. I'm just saying that those are the 2 alternatives, and you just choose the one that you feel is really right for you. And I don't want to make that decision for you. I think that's one of the hard decisions we have to make as parents, right? All right. Anonymous is up next. Hi, Dr. Cabral. I have a moringa tree growing in my backyard. Just wondering how you recommend to use these leaves as they're able to be eaten daily, or are they able to be eaten daily? I've used the leaves before to make a powder. Would you recommend this in a smoothie? Have you also heard of soursop and using the leaves to make a tea? Okay, so it's like yes and all the above. Moringa tea leaves can be great. They're packed with a lot of micronutrients and minerals and all those great things. And so if you wanted to use them, what I would recommend is I would just wash the leaves. You can wash it in ozonated water. I'm using an ozone machine, maybe just a little bit of baking soda, clean the leaves, wash them thoroughly, strain them, dry them, let them dry out. You can even put them dried out in the sun if you want, crush them into a powder, and then you can either just mix them into a smoothie, or you can put them in 00 vegetable capsules and you can swallow them like supplements. So that's literally how supplements are made, by the way. Like people supplements are like supplements. Some are, yes, vitamins and minerals and those things, are extracts. But a lot of these herbs that literally they're just dried, ground down to a powder. You need to make sure, of course, that they're clean. I'm assuming yours are obviously clean, no pesticides, no heavy metals. And then you grind them into a powder. Like that's literally it. So I wouldn't have an issue with that at all. I mean, it's pretty amazing that you have a moringa tree in your backyard. All right, and then have I heard of soursop? I have. Soursop, also known as graviola for people in different parts of the world. And that's a little bit different. You don't grind those. You can actually grind those down to make a powder, and they just call them graviola capsules, right? But soursop, what you do is you just have the leaves. The leaves are going to dry out as well. And then you pour hot water over it. You let it steep for about 10 to 15 minutes. And then you can strain or just keep them in and you just sip the water, right? And those are typically used in cancer support. I can't really go in much more in depth on that, but if you want to read my article on cancer and all the different things that may be helpful in cancer support, you can go to stephencabral.com/cancer. Okay, next up is Anonymous. Anonymous says, hi, Dr. Cabral. I'm more of a Vata body type and I play sports, tennis, and netball. At nighttime, a couple nights a week, I sometimes have trouble winding down. I love these sports as I work from home and love getting out to see people. Do you have any tips on how to wind down and what would be a typical workout week for a Vata, Pitta body type, wanting to gain muscle but not overdo it? Would 3 days gym, 2 days light Pilates or yoga, plus walking every day, sport be too much? Thank you. No, that would be a great routine. Yeah, I mean, I've got so many routines you can go through. I teach in IHP. If you are ever interested, you can go to integrativehealthpractitioner.org or just ihp.coach. No, that's a great routine. It really is for light Pilates or light yoga. Those are recovery days. So call it Monday, Wednesday, Friday weight training, or Tuesday, Thursday, Saturday. But you're also playing the tennis or netball, and that counts too. So, when you're looking at your routine, it might be weight training day, sport day, rest day, weight training day, sport day, and then maybe like the last day is like a yoga or Pilates or something like that. And then, you might just keep rotating like that, or maybe you can do the 3 days a week weight training. You just want to make sure that you're not overdoing it on your nervous system. That's what we have to watch for the most with the Vata body type or the ectomorph is the nervous system. So you can just watch your HRV and your overnight sleep using an Oura Ring or whatever your favorite device is. So what else would you, how do you wind down? Okay. So obviously, you don't want to be stimulating your body very much after 5 o'clock or so at night, especially if you're trying to go to bed by 10. So, by 6 o'clock, ideally, you're starting to wind down a bit. But even if you're not, what can you do? Okay. Carbohydrates help to blunt cortisol's effect. Magnesium also helps the same. Get rid of the blue lights right when you get home. Calming things like a PMF mat, a self, like foot massage, things like that are very helpful. A TENS unit, I'll be sharing one in just probably a couple weeks that you can put on the tragus of the ear to stimulate the vagus nerve. Breathwork techniques to calm the body, binaural beats, all of those things just to really get yourself unwound. Sometimes just a nice, warm, relaxing shower can be great, and that'd probably be great for you, great for most body types. And then nothing too stimulated, just kind of get into that routine, and I think you'll probably do fantastic. All right, Patrick is up next. Patrick's our last question for the day. That's what my team has here. That's our 5th question. And Patrick says, hey, doctor, what do you think about shockwave therapy? And do you recommend any of the ones that are available online? Thanks. Okay, so I don't, have a specific company for you, and I don't exactly know what you mean by online, because the in-person shockwave units are far more effective than the lighter units that they sell online for home use. So you can kind of look at the efficacy between the two, but it's just kind of one thing that you, may want to look at overall. And what else can I recommend for shockwave therapy? No, so I'm for it. Like, I'm not against it. I don't think that you wrote, let me just look at your question right now. Did you write, it's not for anything specific, because I don't exactly know why you're using the shockwave therapy. It's also called acoustic wave therapy, but it usually helps with muscle-based pain or chronic-based injury, but it helps to increase blood flow, which is always great for getting nutrients to the specific area. I've dabbled with it before to break down scar tissue. So if you've ever had an injury and it healed, but it healed tight with scar tissue, it can be really great for that. It can help to stimulate collagen production and tissue-based repair. So like you could use it in the shoulders, you could use it in the hips. Those could be common areas of using it. And then, overall tendonitis, etc. So I'm not exactly sure what you're using it for, but look at the power of the devices. Usually you'll find better devices inside of a physical therapy or chiropractic-based clinic than the home use devices. But if you're using it just for recovery, then home use devices may absolutely suffice. All right. Hopefully this was helpful. Thank you everybody for tuning into the show. I thank you as always. I appreciate you. And for more Cabral host calls and Cabral concepts, head on over to stephencabral.com/podcast. And of course, we'll be back tomorrow with a brand new Mindset and Motivation Monday. Take care. Thanks so much for tuning into today's show. Before you go, don't forget to hit that subscribe button. I want to make sure that you're getting our daily content, not missing out on anything functional medicine, wellness, weight gain, weight loss, anti-aging, living longer, stronger, and all of the most cutting-edge research. And if there's any topics you want to hear, feel free to leave them in the comments below. Take care.